So I'm going to put it back in presentation mode. Okay, give me 2 seconds to make sure it's operating on my end. Okay, and then where's my little Zoom guy? Okay, so let me do like this. 2 seconds. Appreciate your patience. Okay. All right, that should be perfect. And all right, excellent. So everyone should be seeing where it says navigating healthcare. If anyone could confirm that's what they see, so we're all seeing the same thing. Okay, looks like I don't hear. Saba, do you see it on your end? Looks good.
Yeah. Oh yeah, I can see everything on mine.
Okay, perfect. All right. So my name is Brandy. Thank you so much for having me. I am essentially going to be talking to you a little bit more today about your healthcare options as being self-employed, as someone who has to essentially line up all of their own support systems. Okay. I know Saba by working with her personally on her healthcare, and she gave me the opportunity and the platform to talk a little bit more about the needs for this and what you can look forward to. It's for me, with the presentation process, it's very straightforward. Okay. So I'm going to give you some pointers and then let you know what I can do to assist you. But ultimately, I'm here to answer any questions that you guys have. But I just kind of want to walk you through the process, because what I've learned over the years is a lot of people that don't work in healthcare don't necessarily know what their options are. They don't necessarily know what to think about for strategic planning, whether it's immediate needs or forthcoming needs or unexpected needs. So we're going to walk through that a little bit more. Now, when it comes to myself, I have been in the insurance sector for about 6 to 7 years now, but I've been specifically working in healthcare for about 5. I'm licensed in 33 different states. So what that means is doesn't matter where you're necessarily commuting to or where your resident state is, I'll be able to help you out with the healthcare option and give you some really good advice. It's something I enjoy doing. I really enjoy the process of helping people with their healthcare. I enjoy learning more about people and their needs. And I like being that support system to help you navigate through your day-to-day as well as through your future planning. Saba and I have collaborated on things such as her current needs, looking for doctors and networks and things of that nature. And I like to almost be like your concierge when it comes to your healthcare, because it's not necessarily just basic information. Okay.
Yeah, I was telling them that yesterday, that, I kind of just like reached out and you got me all set up, and that even when it came down to finding a provider, I was busy, and I was just like, hey, I need you to at least narrow it down for me. And Brandy was able to narrow it down, send me a few lists, and I actually got all of my appointments set up this month. So I actually just went to my dental appointment. I have my primary
Awesome.
coming up, my
Awesome.
vision, which I've been trying to do Invisalign, not Invisalign, LASIK for so long. I got that set
Mhm.
up, and I'm so excited because it's been like such a back burner kind of thing.
Mhm.
And having you narrow it down was like my weight in gold,
Oh,
honestly.
that makes me so happy to hear that. It's and if you run into any issues with any providers or they have questions in regards to your coverage, and if anybody gives you a hard time, you send them my way,
Yeah.
and I will take care of it. I will literally go above and beyond for you, because one thing I've also noticed in the healthcare industry is not only do people not know how their coverage works a lot of times, it's a lot of information. It's a data overload for a lot of people. And then on top of that, to be fair, and this is with all due respect to anyone who has a family member that works in the healthcare community, not everybody is as up to date on new types of insurance. They don't necessarily know how to process things. There is somewhat of a 9 to 5 mentality, or 12 to 12 on 12 mentality, essentially, for those who work on longer shifts, that they're just there to do what they need to do and they're not as helpful as they can be. So there's been more than one occasion for different carriers where I've had to call and say, no, you guys are not doing what you need to do on your end. This is what the client needs and it needs to be done properly. So I definitely take that seriously. And that's a part of my vision for what I provide. So the pictures I wanted to include it just to kind of bring it kind of full circle with me. The individual that you see on the screen is my mom. And she is someone who, she's no longer with us, but she is somebody who I saw deal with the ups and downs of healthcare. And although I didn't necessarily see myself going into a career with healthcare, my passion was found with helping people just like my mom. People do not wake up choosing sickness. They do not wake up choosing having to have procedures, and they want to make sure that the people that are monitoring their needs, they stay in network with. And also they want to make sure that they can afford the health care that they require. And I have watched my mother over the years not only accrue more doctors and more specialists, and these people have lengthy histories on her, but on top of that, needing for her healthcare uh, price and overall acquisition cost to stay stable. When healthcare was really exploding with price over the last few years, well, I want to say prior to that, she's been gone 4 now, but I want to say in the last 5 years prior to that, there were times that my aunt would have to pay her healthcare premiums. I would have to help out and pay my mom's premiums because it was getting so drastically high and just on a monthly reoccurring basis. And my goal is to not only make sure other people's moms are taken care of and they can stay in network with their doctors, but on top of that, I want to make sure that people can pay their bills and they can still eat and have healthcare that they require. And yes, not everyone is sick. Some people are blessed with health and longevity, but everybody deserves the right to have healthcare. And on top of that, they deserve to have good healthcare and healthcare that they can afford. So it's kind of my focus and my goal, and that's a priority to me, whether you have an individual policy or a family policy. Okay. Now, a lot of people will say, especially if they're not really well versed in healthcare, they'll say, I just want the best price. I just want something cheap. I don't like that word. I don't like that. I just want something cheap. You don't want cheap healthcare ever. And there are some mitigating factors that influence price. So I've included those on the screen. Those are things like age, right? So whether you're in your 20s and your 40s and your 50s, your gender now influences healthcare, male and female. Naturally, females pay more in healthcare costs, healthcare premium than males do. I don't make their rules. It's just the way it's set up around here and in life.
You told me that. You were like, don't be mad at me, but your boyfriend is probably going to get a better deal than you. And I'm like, wait a minute, why?
I just had to preface that because Sava did recommend her boyfriend to me, and I was just like, man, I'm gonna probably end up providing him the same thing, and she's gonna be like, did Brandy try and scam me? No, 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 no. And so I was like, so I have to let her know up front. And I want to say he did get a better price.
Oh yeah, he sure did.
Yeah, he sure did. And he has almost the exact same coverage, if I remember correctly, like
Yeah.
literally like item by item, and he's paying less than she is
Oh
because we
yeah.
have reproductive issues and we have all kinds of things that have to be taken care of. Your location plays a role in that. Okay. You definitely have prices in Texas. Fun fact, Texas is the most expensive healthcare state in the US by far. If you want cheap health insurance, go live in Nevada, go live in Pennsylvania, right? Opposite ends. But by far, Texas is the most expensive
And I'm
state.
like, who told me to move here?
Exactly. So those are things that we take into consideration, right? The little ABC, those are going to be things like types of coverage, right? I always like to tell people that when it comes to health insurance, it's kind of like car insurance, where age, gender, family size, location, married, not married, like these things, they start to fluctuate, right? And then you have, you know, how much coverage do they have? Well, they don't really pay that much. So what your options are definitely mitigate the price as well. So although everybody wants the best price, we want to make sure that we're actually getting what we're paying for. And that's what I'm here to do. I'm the person that's actually reviewing the policy benefits and the declarations to ensure that on the worst day ever, which can happen, you are covered. Does that mean everything's going to be free all the time? No, but that definitely means that you are going to always pay the lowest amount out of pocket, not only on the monthly premium, but on top of that, you're always going to pay the lowest amount when it comes to the medical bills that you will accrue eventually one day. Okay. And then, of course, the last one is policy size. Are we putting 5 people on this policy? Are we putting a baby? Are we putting, just a single female? Are we putting a male on there? Are we putting same genders on? Are we putting it? There's so many other things that influence pricing as well. So I wanted to kind of touch on that because a lot of people, they don't necessarily consider that as a factor. And for people that work for themselves, all of us, I work for myself, maybe we may have been used to having an employer subsidize the cost of insurance to where we were paying a very low amount, and now we're in shell shock because we're like, wow, this is what healthcare really costs. So again, I'm shopping for you. I'm doing the legwork on that end to essentially narrow down that 150 list of provider carrier options, maybe down to top 2 or 3 for you to consider, a couple of contenders, so you're not overwhelmed with a bunch of data overload. And then on top of that, you can pick something that makes sense, okay, in an efficient time and manner. Now, other things, people like to think about the what if. So what if I need to find a new doctor? That was Saba's experience. What if my prescriptions are expensive? We have people that get injections of Botox to manage migraines. That's practice. There are so many different things that people deal with on a regular basis. You want to make sure that the insurance is going to cover a good portion of it. What if we're thinking about having a baby? You want to make sure that you have a baby on the right coverage. No one on this call might be having a baby right now or even thinking about that. Kids are expensive, not only to raise them, but to birth them. Healthy pregnancies versus high risk pregnancies. There's so many factors to consider. So if you're going to strategic plan every other area of your life, why not strategically plan your healthcare? Because statistically speaking, you may end up using it. Okay. So those are all things that we like to take into consideration when we're planning. And you and I, whenever we do talk, or if you'd like to speak with me, we can sit down and make a list of your priorities. And then once we talk about all those priorities, we'll be able to outline what makes sense. Which way are we going to go? Okay. So I want to give you an example of what a coverage comparison may look like. Okay. And these are just, we're going to go across the market. Okay. So on what would be the furthest left would be a government ACA plan, right? Those are government plans that are contractually facilitated from January to December of every year, and they change. So for instance, we're going into open enrollment in November, where everybody will be picking their plans for January 2023, and those plans will run from January 2023 to December 31st, 2023. And it's just a revolving process, right? So right now, and I want to say a demographic, I think I even used Texas. I wanted to, because that was like the most expensive state. So I wanted to use an example. Now, there's so many different levels of network. There's different co-insurance levels. There are so many factors that put together and make your policy have value, right? So as an example, a policy that I literally pulled from the marketplace, you have an HMO level plan, 70/30 co-insurance, okay, with a $0 deductible, an $8,700 out-of-pocket maximum, and free wellness, right? Because all plans come with free wellness, essentially. Most of them do. Now, in the state of Texas, this plan, as is for a single individual, is $544 a month. That's without any type of subsidy access, low income discounts, if you would. That's a lot to pay for healthcare. That's a car payment, essentially, right? Now, in comparison to that, if you shop around and you have broker relationships and you're able to see essentially what those who have licenses are able to see, you could go with a private policy. Now, here's the cross comparison. So you have a PPO level plan. So now you've graduated to nationwide coverage, $0 deductible, $3,000 out-of-pocket max. You can get free wellness, right? Dental, vision, critical illness coverage, and 24-hour, 7-day-a-week teledoctor services, $342 a month. So now we've dramatically reduced our premium, and we've got a lot more coverage because we've shopped in networks that we publicly do not have access to, right? And then we have a short-term policy, same zip code, same area. This would be considered a traditional indemnity plan. It will give you 80/20 coinsurance, a $5,000 deductible that renews every 6 months with a $15,000 out-of-pocket max. And that's $182 a month. I always like to tell people short-term plans are your if I get hit by a bus policy, because you can't use them for the day-to-day. You'd have to pay down a $5,000 deductible whether you're going to a doctor or being admitted for surgery, and your liability for how much you're owing in medical bills is much higher. But it's cheap though. So I like to have those conversations because we need to outline what your goals are. Do you just need a policy to cover you for a little while before you get on your spouse's plan, right? Through their job, because work insurance for the most part is pretty great, for if you can jump on a spouse's plan or whomever. But in the meantime, if you are going to be self-employed, you want to know what your benefits are. You want to know that these are tax write-offs. You want to be able to get some guidance on how to pay your premiums so that you're getting the best taxable advantages at the end of the year, because being self-employed is not fun. Like in the sense of your taxes, you go from getting your tax return to having tax bills. So definitely ways to take advantage of deductions are important too. So I definitely help in that area as well. But this is just a cross comparison of the market. Okay, but we do talk about this on our call, and these numbers are subject to change. These plan options are subject to change based on what carriers you want, how many people are in your family, what prescriptions you need covered. There's just so many things that go into it. So it's really important to talk to somebody about it specifically. Okay. Now, so what do I provide? I've talked a lot about, hypotheticals. So first and foremost, I go ahead and give you a market-wide analysis of the public, private, and supplemental options that are available in your area, because based on federal law, state law, you're only able to have healthcare in your zip code unless you have a residence somewhere else. So I can't shop for you in Nevada, although you live in Texas or Georgia or Florida. You have to do it where your resident state is. So we're going to review all those options. I do a lot of qualifying before I even get you into a consultation, because I know what your data is. So I'm able to start, narrowing things down so we don't necessarily have to take up too much of your time. I also provide network verifications. I want to make sure that all of your preferred hospitals, physicians, specialists are going to be in the network that you're choosing. The worst thing you can ever do is get a new insurance policy and none of your doctors take the coverage. That's the worst feeling in the world. You're helpless and you don't want to have to leave your doctor because you have an insurance plan that's insufficient at the network level. And for someone like Saba who needed new doctors, I'll be there for that as well. I will run you lists, tell me what you need with the kind of specialist, the location, and I'm going to just create a queue for you or in a query on that data and then send it over. And then you from there will pick what's best for you. Okay. Cost savings evaluation, I do that as well. It's an individual assessment of cost savings offers. Is your reported income going to put you in a position as you're self-employed to get tax subsidies? Are you at tax risk by taking advantage of subsidies? Are you able to take advantage of different cost benefit offers that are provided from different types of companies and plans? The goal is always to pay the least amount with healthcare, right? But at the same time, we want valuable coverage. So I take an analysis of that too. And then lastly, you have your advisor assisted enrollment. It's one thing for me to help you pick out plans, but then what if the paperwork's not filled out correctly? And a lot of the insurance companies make us fill out the paperwork. So Saba did it with me as an example. So I walked her through her application. I made sure everything was filled out correctly, verified all the data, and submitted it. So you never have to worry about getting lost in paperwork or digital paperwork, because I'll be taking care of that as well for you. Okay. Now, I want to talk a little bit more about, I wonder if this is in your way. Hopefully it's not. I'll just move it just in case it is. So when it comes to how long does it take, right? Well, how long am I going to have to stay on this call with Brandy, or how soon can I get my coverage? So the way you would go about getting in contact with me, and we'll talk about that as well as the process. So the process would be booking an appointment. Okay, one-on-one consultation. So you and I will have an online consultation. It does not have to be on Zoom. A lot of it is done on screen share, on non-video based screen share, as well as over the phone with myself. We have the consultation, we narrow down your coverage options, we're able to go ahead and set you up with a plan that you think is going to be a good fit for you. And then from there, we complete your application and enrollment. And the reason why I say application and enrollment, I'll touch on that a little bit more because different companies require different documentation. And then from there, your insurance cards are mailed and it just gets to you within mostly 7 to 10 business days. And then a majority of the carriers, depending on where you're getting coverage from, will give you a selected start date or effective date. Okay. So again, booking your consultation. We actually have the consultation. I help you apply or enroll, and then insurance cards are on their way. So it's very, very simple. I try my best to make it as seamless as possible. The less work you have to do, the better, honestly. Now, on the left side of the screen, kind of in our little thought bubble, I want to talk a little bit more about things that are important to you, which we will discuss on your call as well. Applications versus enrollments. So with applications, right, you're applying for approval. Whereas enrollment, you're just enrolling and you're automatically approved. So with applications, you go through the acceptance process, which doesn't necessarily happen overnight, right? Some people's acceptance process can take a couple of weeks, depending on what the insurance company requires from them or what resources have to be utilized to make sure that they're a good fit for the policy. And then some plans are going to just allow you to enroll, and you're done, submit, and you get a confirmation email. So it really depends on each carrier, and we have to look at that to make sure that we fall in line with what is required. You have start dates and effective dates. So start dates I would refer to those as, I want to start my coverage on a specific date, right? I want coverage, but I don't want it to start until October. Or I actually have a plan right now that I'm transitioning out of, and I want it to start 15 days from now. With start dates, and certain companies and policies allow you to choose when your reoccurring monthly premium is, and then on top of that, your start date, okay? Now, some policies have effective dates, which mean this is when it's effective regardless. So as an example, marketplace plans are like that. Marketplace plans are what you know as Obamacare, ACA, healthcare.gov, marketplace, whatever you want to call it, the exchange. Those are traditionally plans that you will get with your employer as well, because they take care of group-based ACA plans that group offers. Those are the first of every single month, no matter what. And they all have to be enrolled in at least by the 30th or 31st of the prior month. So they have federal rules. So again, we want to observe that as well, depending on your needs or your requests or your desires and what's available in your area. So we'll look at that also. And then you have plans that are guaranteed issue policies. And then you have medically underwritten plans. And those are going to be options for you also. Guaranteed issue plans mean you're guaranteed that the policy will issue out to you and you're good to go. There's no questions. There's nothing that has to be qualified. You just automatically receive coverage. And then you have your medically underwritten plans, which mean you have to be approved. Those are typically fall in the application line. You have to be approved for acceptance based on your health status. And yes, that is a way to kind of push you in one direction or the other, right? Depending on whatever your requests or requirements are. But ultimately, you get benefits from both. So again, healthcare is very individualized, so we want to make sure that it's a good fit for yourself based on what you need. And everybody needs something different. What I need from healthcare and what you need from healthcare are two entirely different things. So we want to make sure that everything is customized to you and your success and your happiness and your goals. Okay. Now, get back on my screen. Another thing that's really beneficial that I'm able to provide to my clients is I am your personal advisor. So that means you can contact me if you need me to look up doctors and hospitals and networks and specialists and dentists and everything like that. And I do provide on-demand assistance 7 days a week. She's making that up. She doesn't work 7 days a week. I kind of do. I don't mind working a lot. Primarily, my in-office hours are Monday through Friday, but I'm always available via call, via text on the weekends. I've had clients call me and text me at 11 o'clock at night because they had questions about 24-hour MD live coverage because their kid is sick, and it
Yeah,
gives me
honestly,
pleasure.
I think I had messaged you probably on the weekend, one of those days, and I was just like, because now we can't schedule messages with the iPhones. I was like, I need to just drop this message here so that I don't forget. And then I was like, just ignore this. I know you'll get it, but like ignore me until Monday. And then you just sent me, instead of just talking on Monday, you just took my message and ran with it. And on Monday, you emailed me all the doctors. So we didn't even have to really talk after that. I just
Yeah.
needed to drop it there, even though it's the weekend. I was like, I really hope she ignores this. And you definitely didn't ignore it.
You know, and I don't mind because I'm one of those individuals that when something's on my mind, similar to yourself, I got to get it out of there before I forget it because it's going to be gone. But at the same time, I also like instant gratification whenever I can have it. So if I can help you with your questions, naturally, there's only so many things I can answer via text message. Sometimes those are more lengthy conversations. We may have to jump on a quick call so I can answer your questions more readily, but I do not mind you reaching out to me. Majority of my clients have my personal cell. So like Saba has my personal cell phone. So you literally have access to me no matter wherever I am. So I like giving that. I've been in the field long enough to where I don't mind giving out my personal cell phone, to be honest with you. Now, I do help also with policy questions in network physician searches, hypothetical scenarios. During a consultation, I'm definitely relaying a lot of information to you. So I cannot expect you to be an expert on what you've learned. The goal is to make sure it all makes sense to you and you do like the coverage that whatever you select for yourself. And I want to break down everything and make things make sense. But sometimes you need a policy review. I had a client in the Nevada area that reached out to me last week, and she had a hypothetical, what if this was to happen, then I would do, and then what would I do here? And we sat on the phone for 2 days in a row for hour appointments talking about hypotheticals because that's what she needed. And I just appreciated that she was so appreciative, and it made her feel content. It made her feel comfortable in something that is not her specialty. And, she's a nurse, she's a traveling nurse. So, go figure. Again, I'm available via call, text, and email. So you can definitely get me either. I'm the quickest via text though, because I am on consultations, and I told Saba this like all the time. I've blocked this time to speak with you guys. So if someone was, I have text messages lining my phone right now. They just have to wait. So if someone's going to call me, they're just not getting through at the moment. So definitely don't panic. If you were to ever call me, should I provide services to you, just shoot me a text. I got you. I'll take care of you. So don't worry about it unless it's emergency. Be like, Mayday, call now, hang up with whoever you're on the phone with. So definitely help you in your time of need. A little further, let me see what else I got for you guys. How do you get in touch with me? Okay, so you definitely want to get in touch with me a couple of ways. I tried to make it as easy as possible. I have a website. It's called planwithbrand.com. It's my personal website. You can email me at booking@planwithbrand.com. That's my personal cell that you see on the phone. On the screen for the phone and text. And I am transitioning into social media. So I have a Plan with Brand TikTok, and I have a Plan with Brand Instagram. So I'm giving it a shot, guys. But I definitely see a need to reach out to people in areas that they frequent more. So definitely reach out to me there. I've also created a barcode for you guys. So anybody who's watching now, if you're not watching from your cellular device, because naturally you can't scan your own cell phone in most cases, if you're in front of your computer, you can actually scan that barcode, and that barcode will take you straight to my calendar booking. Okay, so I'm just going to skip over here real quick for us. And so when you go there, you're going to go straight to my Calendly, and that way you don't have to necessarily communicate with me if you don't want to, or you could just text me right now, or whenever you feel like it, that's fine too. But if you're like, I just want to go ahead and book, and I'll get to it when I get to it, then I would recommend you pick the initial virtual consultation. So right there, because I do have follow-up calls and business calls and marketplace enrollments and things like that. Even if you end up being a marketplace enrollment, that's fine. Just book your initial consultation, and then you just follow the prompts through Calendly, and then it automatically puts you on my calendar. So it's a super easy process. Don't ever worry about it being confusing how to get yourself booked. We'll take care of it for you, okay? And then just a bigger version of that barcode is right there. But otherwise, that's mostly what I had for you guys. I know I kept it around 30 minutes. I didn't necessarily have an hour of content because healthcare, again, is very individualized. So it's going to take a little bit of more in-depth private and confidential conversation for us to go over your needs. But again, if you need things like prescription resources, I have really great programs for that. If you are an expecting mother, I have programs for that. There's mostly a very few things that I can't handle. I don't typically handle Medicaid, and I don't typically handle Medicare, but anything outside of that range, that spectrum, right? Those outliers in the bell curve, I will take care of it for you. If not, put you in contact with somebody that specializes in a particular thing that you're looking for. So I'm happy to help you. Definitely schedule your consultations. If you are in a marketplace plan and you're coming up on open enrollment for this year in November, we can talk about that too. If you need extra resources for different things, I can teach you a lot about different services and applications and things that will make you navigating your own healthcare a lot easier that we just don't know if you don't work in the field. So other than that, that's all I have. I do appreciate you guys giving me your time. I am here to answer any questions. I do know in this case, a lot of times questions will be private, which we can talk about on a more private basis. But
I think
go ahead.
Jennifer, you have a question? You can go ahead and unmute yourself.
Hello, ladies. Thank you so
Yay.
much
You're
because
welcome.
one, my mouth dropped when you said Texas has the most expensive healthcare because you could not tell me that it was in New York. So I know
Yeah.
you only work with 33 states, and I was like, I hope she works with New York, because New York overall, when it comes to anything, is overly complicated.
Mhm.
And
Yep.
so one,
Mhm.
compared to Texas, is New York lower than Texas prices? And two, do you work with New York state?
So specifically, me personally, I have experience in New York. I don't currently work there, but I do have resources for you that could assist you in New York.
Didn't think so.
I want to say
Too
when
good to be true for me.
there are some states that their regulations are
Ridiculous.
uncanny. New York, New Jersey, another
Mhm.
state. Oof, that whole area of the map is very peculiar. They're very, very peculiar, but I can definitely walk you through healthcare options. I can provide them to you. I want to say Texas is still more expensive. I want to
Mhm.
say it is. When I worked in New Jersey, their rates were competitive with Texas, but something about Texas, I literally have the most expensive policies there. They could be around the same now, but let me get some information from you. Let me point you in the right direction to make sure you have some options and offers. Right now, currently, New York's regulations won't let non-resident producers. I live in Florida, so I have
Mm.
non-resident licenses in different states. That's what I'm listed as in my licensure. Florida is not allowing, at least for me, not resident state approved work. So, but I can definitely gather some information from you and do the legwork so I can make it a little easier. I'd be happy to do that.
Okay, thank you so much.
You're welcome. Anybody else, feel free to unmute yourselves. I'll be happy to help, in addition to you calling, texting me, and booking with me. So, but I'll be happy. I know. Let me see if I can open the chat.
Kenya asked, do you work in Maryland or North Carolina?
I work in North Carolina currently. I also work in Maryland currently. So yes, absolutely. We have a Pennsylvania. I'm going to double check. I was put on hold, and again, another resident state issue with Pennsylvania, but I do have contacts in Pennsylvania. So I can definitely help out Chrissy in Pennsylvania. But yes, I do work in Maryland and North Carolina. Maryland is, we should get on the we should get on the phone soon. If you're in Maryland, do you work in Oklahoma? Yes, I work in Oklahoma. Maryland is a little funny state. When open enrollment hits on November 1st, they become resident only. So if we want to look at options for Kenya in the Maryland area, just get on the phone with me before November 1st, because after that I'm blacklisted until January. So until middle of
Really?
January. Yes. States that are the resident only states right now, that are just cross federal guidelines are, during open enrollment, traditional federal open enrollment through the government would be Maryland. I can possibly get certified in Maryland this year to be a non-resident producer. They make you go through a couple extra loopholes, but I can. I'm waiting for them to do the release for us, because a lot of licensure and a lot of regulations for open enrollment are coming in the next month or so, because they're getting prepared to get everybody with their CEs to be able to help with marketplace policies in addition to private healthcare and things like that. Arizona, resident only state, can't touch it. You have to move there to work in the state or have a actual house there. They won't even take PO box. You actually have to have like a literal physical address. And unless you complete, like, I want to say 40 hours of, in traditional 40 hours, like you're sitting through 40 hours of continuing education and types of like releases for Colorado. They will blacklist Colorado for open enrollment. Don't know what it is. I'm definitely going to, because I work in Colorado and Maryland now, definitely going to see what the requirements are this year to work there. I would love to continue to work there for the open enrollment period, but sometimes it's just, they won't let you at all. So just a couple states, a little weird. New
Okay,
York, another funny state. So
I have another question. So I was talking to Saba about this. I thought it was close to 4, but it's really closer to 3. I work for the federal government right now,
Mhm.
and I pay $230 a month
That's good.
insurance. Oh,
Mhm.
you said that's good?
That's a good price.
Oh,
May I ask your age on the call, if that's okay? Just age
yeah,
range.
42.
Ooh, honey, that's a great price.
I don't mind then.
It is. And that's the thing. You're like, right. I didn't think it was a great price. $230 a month for a female in the age range of 40, right?
Yeah.
You are likely, my gut instinct and my experience would say you're getting it subsidized by the employer, right? So they may be paying a portion of it. We could
Right.
certainly look into offers for you, but $230 a month, absolutely.
Okay.
That's a great price for healthcare for female,
Okay.
age, and then location. And then again, type of coverage. If you're working for the federal government, a
Mhm.
lot of times the federal government has unmatched coverage. Sometimes they don't, sometimes they do. Arguably, TRICARE is the best insurance in the country. But I literally had somebody on the phone a week ago that was just like, yeah, TRICARE is okay, but I don't really care for it. And I was like, wow, it's the first time I've ever heard that in years. So it just really depends. As I currently work for a dental vision company, do you recommend electing COBRA for dental and health, and then selecting our own healthcare, or skipping COBRA? COBRA, I didn't mean to, before I answer that question, the last person that asked me about the healthcare, did you have a follow-up question for me? Because I didn't want to skirt past you.
Are you talking to?
Yeah, the $230 a month.
No, that I didn't know that it was a good price because it's with Aetna. So I mean, we can talk still because maybe, I don't
Yeah,
know.
let's talk about that. Aetna in a majority of states is short-term only unless you get it through the employer.
Okay.
So Aetna is good in most cases as long as the providers take Aetna, because then you might find yourself in a position where you're just like, hey, I have this insurance, but no one takes it.
Got
So
it. Okay, definitely. I would definitely set something up with you.
yes, set something up so we can at least troubleshoot and
Sure.
kind of go through those options. Because even if I can't help you with healthcare, meaning I don't personally provide you with an option, I'd rather you leave the conversation really educated so you feel a little bit more
Absolutely.
comfortable. You
And I
know what I
might be
mean?
able to change to another healthcare. So definitely.
Yes.
Yeah.
What I also like to do for clients is if you're getting a new employer offer, like September and October are traditional employer offers, meaning open enrollment period for the company you work with. So I've had a lot of people, they'll split their families. So like a young lady that I worked with a couple of weeks ago, she's going, it's crazy. She's going on the employer plan. It's $15 every paycheck, $30 a month for great coverage, like great coverage. But if she adds her husband and her child, it's $1,000 a month. And that's because the employer, and for all intents and purposes, they are only required by law to pay for your healthcare. Your family does nothing for this company in the equation of what is deliverable, right? So when it comes to that, I was able to find a policy for her husband and her child, right? And it was like not even $300 a month, right? For the two of them, great coverage. And then from um, sorry, I was reading the chat. She's going on work for $30 a month and they both have great coverage. So it's her open enrollment period. I say all that to say in her policy, a decision is due by the 1st of September. So for those of you that are going through that full circle, I'd be happy to look at your benefits with you, because that's what I did with her. She was like, I don't understand this paperwork. Can I screenshot? She sent me cell phone screenshots, like pictures. And I was like, okay, well, that's what this means, what that means. And I'm happy to make sure that if you're just going to go with employer, pick a good plan. Like, you know what I mean? It would suck for you to have a plan, and suck is not a professional word. It would be terrible if you had a plan that you're paying nothing for or something for, and again, you can't use it. So definitely I'll help you out. Let me know. Be happy to do it. Let me go back
Thank
up
you.
to this one. Yeah, you're welcome. Before I move on, any other questions for me?
I have one.
Okay.
If we're younger than 25, should we start thinking about healthcare now or wait until that time?
So for people that are under 25, so per the federal government, age 26 is when you are booted essentially off of a parent's policy, whether you're a
Got it.
full-time student or a full-time employee, or you live full-time at home, whatever. So if you are 25, you can certainly ride out the other plan until 26. Deadlines for that vary. Sometimes it'll be on your birthday, you're out of there, and then sometimes it'll be at the end of the month, whichever comes first. Definitely start looking into your options. It sounded like a female voice, so your
Yes.
healthcare is definitely going to go up in cost. So we want to make a good analysis on what's going to be beneficial to you, because we want to get you the lowest cost ratio, especially since you're female. But definitely don't wait until 26. And what I deal with a lot is I talk to 26-year-olds that are currently uninsured, and then they wait months until after their birthdays, so they're not even eligible for special enrollment. Some people have severe medical conditions that have to be addressed, and now they have to go without coverage. There's just so many what ifs. So if you want to talk about future planning, whether your birthday is next month or next year sometime, we can talk about that too. So you can kind of have your priorities in order when it comes to, is my priority my network? Is my priority my, my monthly premium? Is my priority my deductible, my out-of-pocket max, or co-pays or co-insurance? We'll outline what's important to you, because just as a general disclaimer, healthcare is never going to be perfect. Like, you're going to have something that you wish was better with your plan. Everybody in the grand scheme of things wants the cheapest policy with no deductibles and $1,000 out-of-pocket max and a PPO and 80/20 coverage, or even platinum at 90/10. Everybody wants everything to be perfect. So in the insurance field, we like to say we want to get you the best of the worst, because there's nothing that great about healthcare in general. Like, there's always something that could be better. And those offers and those availabilities change constantly. So if you don't necessarily work in the field or carry a license, it's going to be hard for you to see what's other than what's on, healthcare.gov, or what's on the internet for some of these clickbait pages and click funnels. So you definitely don't want to find yourself at the bottom of a click funnel. You don't want to do that. So that is my long-winded answer to that. Anything else on that one?
No, that was it. Thank you.
Okay, perfect. Go
Alondra
ahead.
has a question in the chat.
Yes, she said, I currently work for a dental and vision company. Very cool. Do you recommend electing Cobra for dental or health, and then selecting our own healthcare, or skipping Cobra? So that's a loaded question. Typically, when someone is offered Cobra, it is because they left their previous employer. Cobra is, in most cases, more expensive than any other coverage. And Cobra is essentially your portion of the premium and your employer's portion of the premium together in one for you to pay. And Cobra is only good for 18 months. Typically, the only reason people choose Cobra as a health option is, one, they generally speaking have a lot of medical conditions, and Cobra is going to be a traditional major medical. It would have been what you had at your previous employer in most cases. And it goes for 18 months and then they kick you off anyway. So you have to go through the healthcare search again. So people stay on it because they have a lot of medical conditions and they just don't want to deal with change at the moment, or they have a better offer that's coming up and they don't mind the increase in premium. So for instance, lady I helped last week, she's a researcher. She is taking a new position, and her health insurance doesn't start for 2 months. So they are offering her Cobra, and she carries the whole family. She has 4 children and her husband. They're all moderate ages. I want to say both her and her husband are mid to late 40s from what I recall. And her children are ages 12 to, I want to say 24. So right in that age range, about 4 of them. So I was able to give her a couple options. She could go with, a regular private-based policy that was about $1,000 a month to give her comfort, or she could go with something supplemental to hold her over for just a couple $100s a month for the next 2 months just to get her by. But if she selected Cobra, it would be $2,000 a month. So $2,000 a month for 2 months when you typically don't use your health care just because it's Cobra, and it's because you're picking up your employer's portion of the premium. So I don't recommend going with Cobra. Your choice on whether or not you want to go with your employer's healthcare is contingent on, do you like the benefits? So a lot of people during open enrollment will reach out to me and say, this is my new offer, but I don't have to go with work. Could you find me something cheaper? They usually say that. Or they'll say, could you find me better coverage because I hate my work plan? And a lot of times I've noticed that people will choose dental, vision, short-term disability, what we call ancillary coverages. They will choose that with the employer because it's dramatically cheaper than shopping on the open market. For instance, sometimes a dental policy will be $13 a month, right, for all-inclusive dental. But if you were to shop it on your own, and that all-inclusive dental comes from the employer because they have it at a group rate. But if you're shopping at an individual rate, that same dental or similar dental will be about $40 a month. So sometimes for cost acquisition and you know, cost effective ratio, you want to go with that cost benefit analysis, go with the work for the dental, but then outsource your health. And then there are other things you take into consideration. If I outsource my health, then I will be able to take that offset and it gets put back in my salary, or whatever the arrangement is with the employer. A lot of employers will offer different incentives or different options when it comes to shopping for healthcare. So I don't recommend you go with COBRA, unless, of course, there are some serious medical conditions that we can talk about, or not implying that you have any. But I don't see the purpose of going with COBRA because it's temporary. Your own healthcare might be great as a company. If it's not, we can kind of look at some competitive options, and then you can kind of apples to apples them both. But I probably would recommend you go with dental if they offer it. And they let you pick one. Majority of carriers or majority of companies will. So that was a long explanation, but yeah. Let's see. I was so late. So I'm happy with my coverage, my plan, but if I leave my employer, are you able to search for a plan that is similar? Yeah. So what you're probably experiencing with your employer is that traditional major medical. So traditional major medicals are going to come from the federal government, from the employer. And then there are a lot of private carriers out there that will give you something very similar to the traditional major medical. It will be different because some of them are medically underwritten. Some of them provide different options that are just kind of like the best of both worlds. So we can look at that. So if you are interested in leaving the employer, sure. Some people call me for consultations more often than not and say, I have a job offer, but my offer acceptance is contingent on if I can afford healthcare, because that job doesn't have a healthcare plan and I want to be able to still provide healthcare to my family. But if the cost is too high, then I have to stay where I'm at. So some people won't make job moves unless the healthcare is right. So we talk about those too. I guess my view on COBRA, of course, looks affordable since I can see dental vision rates people pay, but I didn't look at it from the healthcare view. Definitely answer my question. Awesome. Definitely we'll look at that together. You guys can feel free if you have offers through other employers or through spouses or through whomever, send me over the explanation of benefit, or not the explanation of benefits, but the breakdown of coverage, plan summary. I'll be happy to look through it. There are certain fine prints you want to read, exclusions, waiting periods. You want to look into that stuff too. Health insurance is like, it's still a legal document, essentially, right? So you are legally bound to the contractability of that coverage. Yes, health insurance outside of an employer is non-contractual. So what that means is whether you go with a government plan, a private plan, a short-term plan, health sharing plan, whatever, you can cancel that thing whenever you want and get your money back or get a prorated amount. And every plan comes with its benefits and disadvantages. But with that employer plan, more often than not, and most generally speaking, when you sign that employer plan and you submit it to HR, that's a wrap. You are in that policy for the next 12 months. You cannot leave it. Some employers, depending on the size, will say, yeah, if you want to drop your coverage, we'll let you drop your coverage. But I want to say 80% of the time you're stuck. So if you do have some decisions to make, let's do it not the last week before the coverage plan is due. Let's do it like 2 to 3 weeks in advance to make sure you have enough time to find a new plan, especially if that plan requires you to be approved. I've literally had people the day before their documents at work were due were asking me to find them a plan, and a lot of their plans that they were interested in had applications, and it's been to the hammer of 5 o'clock on a Friday, and I am trying to get a decision forcefully made so this person can determine if they can leave work right now and submit this paperwork or not. So let's not wait till the last minute. Let's let's schedule out a couple weeks in advance to make sure we don't have any hard deadlines. So but those are really good questions. Anybody else with questions? No? Anybody in the chat?
You go back
Did I miss one?
to the screen before this one. Could you go back?
Yep.
That
one?
maybe the screen before this one.
Right there.
Yeah, so that I can tag you on Instagram. Same for y'all. If you all actually Brandy, if you want to go all the way to the first slide with the title, you all can take a screenshot or share this on Instagram that you're learning this right now. I'm about to share it on mine as well. Because I think it's really helpful. One of the things that I really didn't like I thought about, but I never saw any type of training or anyone talking about it, was getting healthcare once you go, full time. Like a lot of people promote, being your own boss and being your own boss, but they don't realize that being your own boss also means that you also have to carry your own insurance. And so I was so excited to quit my job until I quit my job, and then I was like, damn, I probably should have got my LASIK surgery before I quit, because now I gotta go find insurance. So I
Yeah.
really, this is like so good for the self-employed, because this is something that's absolutely not talked about enough.
Yeah.
Alondra said, does time of year make a difference on plan price?
Yes. So, oh, you're welcome. Time of year does. So let me pull back on that. For marketplace plans, time of year effectually does mitigate your healthcare price. So if someone was to say to me right now, Brandy, I want to shop for healthcare for 2023. Do you know the rates yet for government insurance, right? No clue. None at all. But I will November 1st. I don't even get a sneak peek at rates. You know what I mean? So I won't know until the morning of November 1st when I start shopping the marketplace for people that are ready to do their enrollments. The marketplace specifically, which includes your employer coverage, if it's a group plan, an individual policy, they are subject to incredible inflation. And that is not me, someone trying to market a particular brand or type. It's literally subject to inflation. So the way the government works is everyone is approved no matter what. And that's through the Affordable Care Act. So that means regardless of your gender, regardless of your age, regardless of your medical condition, you could be incredibly healthy or currently be battling liver disease, stage 4 cancer, you're approved. So that creates what's called an uncontrolled risk pool. Okay. The pool of risk of the people that are in that big pool is uncontrolled because we don't know who's got what's happening, and there's no standard, right? So because of that, the insurance companies cannot forecast how many medical claims they're going to have to pay, how many surgeries are going to be needed, what is going to be approved and not approved when it comes to payable benefits with a lot of plans. So because of that, market changes and the number of enrollments influence whether those prices go up or down. You may have noticed last year the new administration had the COVID relief package. So the COVID relief package had a contingency where based on your annual reported income, it allowed you to get a certain amount of subsidy. So they increased the income eligibility for subsidies, which means the government gives you a break on the monthly premium. So you pay less based on how much you earn per year, right? That was supposed to expire at the end of this year. And then that was going to send marketplace premiums through the roof if that expired, but they extended it. So that is going to stabilize healthcare premium costs for certain levels of reported income. But ultimately, the sicker the population is and the cost of healthcare is just continuing to rise and is slated to rise over the next 7 to 8 years, meaning doctors got to be paid more, nurses have to be paid more. Look at what the COVID pandemic did to healthcare. Hospitals were swamped. You know what I mean? It was swarmed with people in need, which drove up costs for medicines and supplies and things like that. All of that contributes to the cost of healthcare. So yes, time of year is really important. For most private plans, those are going to stay stable year round for a few different reasons in general, but the most uncontrolled group is going to be the marketplace. So we're going to see a huge rise in inflation or kind of a little bit run of the same at the end of this year, but I do expect a rise. The marketplace on average, usually 200 to 300% increase every year, especially with us coming out of the pandemic a little bit, even though it's not like COVID's really disappeared per se, but that's a conversation for another day. It's still, medical need out there. You'll see some price changes if we can secure you a subsidy definitely we'll go that route. But ultimately, if we could look at some different affordable solutions with different types of carriers, we'll do that too. So you avoid those market rates. And then when it comes to you can't really avoid it though if you don't have a subsidy access, or you don't have an alternative anywhere else. You will be subject to those prices no matter what, and those prices will roll out in November. They start in January, and then the same process. It's like a cycle that never ends. So, but my job is to make sure that you get the most affordable healthcare there is, and I'm going to look at everything that's available, because you're only going to have so much in your state. So gotta run. Thanks for the information. It was insightful. You're welcome. Any other questions for me? Uh-oh.
Tiffany.
Yes, I had a.
You're
Oh, no.
going in and out, Tiffany. Your voice. I
Oh,
wonder if
no.
she's on her phone. Can you hear us, Tiffany? We can't really hear you. Your voice is going in and out.
This is a question. So I have been.
Oh, there it is.
Me and my husband. Do I sound better now?
Yeah, much better.
Yep.
Okay.
Oh, no.
Sorry,
Wait, you went out again.
I was trying to drive home. I apologize.
Okay.
So me and my husband.
Oh, no. We almost had her for a
Can you hear me
minute.
now?
Yeah.
Can you hear me now?
Yeah. Can you hear us?
Do I sound better?
Yes.
Yeah.
I can hear you. So I sound good right here?
Yeah. I'll drop you a message.
Okay, maybe I should. Okay. So my struggle with insurance currently is when I'm trying to find coverage for my family, they will get approved and I won't, strictly because of, since I started having children, I've kind of struggled a little bit with blood pressure. And so my family will get approved and I always seem to get denied. And
Okay.
that's been a struggle bus. And I actually had insurance, another company helped me get insurance, and then I started having issues with it, and I literally started reaching out to the company and nobody called me back or even emailed me. I can't even tell you the name of the it's a big company that helps people get insurance.
Okay.
And they kind of just left me flat. So I don't have it any longer, but that's something I've always struggled with, is that I can get my family coverage, or our kids will have to get under my husband, but I can't never seem to get approved. So, but I know I need it. I need to work on trying to get something. But
I gotcha.
when I talk with insurance providers, they make it seem like it's nearly impossible.
Okay. So to answer that question, there are a couple of, again, there's two types of plans. You have medically underwritten plans, and then you have guaranteed issue policies. Typically with the employer, you're going to have a guaranteed issue plan for the most part, because they will lean on the government marketplace to provide group offers. But then you have private plans, which are just private plans facilitated through private companies. And those companies will too offer guaranteed issue plans, but they also offer medically underwritten plans. Now, medical underwriting, let's go with the concept of life insurance. When someone wants to get and this is just for the whole group as a standard, when you want to get $1 million policy, that life insurance company really hopes you are the pinnacle of health, because if they're going to pay out $1 million, they want the likelihood of paying that $1 million to be slim to none. Now, that's why they offer medical underwriting. So they make you do height, weight, and blood pressure. They make you go ahead and get your blood work done. And on top of that, they may have you provide medical records showing that your prescription history is stable. You also have life insurance policies that are GI. So you just pay your $75 a month for $250,000 in cash if you pass away. Medical underwriting is a way for you to get more and at times pay less, depending on the provider. So for you to tell me that you were not being approved for coverage, that leads me to think you were trying to get on a medically underwritten plan, because a guaranteed issue policy, which is the only other side of the spectrum, will automatically approve you because it's guaranteed. Just to kind of point out things that would affect medical underwriting for, let's say, a high blood pressure diagnoses, or what's another one, or like an anxiety diagnosis sometimes is specifically for high blood pressure. They consider a number of things. How long have you had it? Is it considered controlled by medication? Have you been taking the medication for more than 12 months? Was there a change in medication within 12 months? What's the height and weight ratio look like? If you haven't gotten a recent physical but you try to get medically underwritten life insurance, I see that happen with clients where, let's say, they lost a lot of weight or they never had a weight issue, but their blood pressure at the time was uncontrolled because they were just having a bad day, white coat syndrome, where your blood pressure is just generally higher that day. And that was the last record you had. They're going to assume your blood pressure is out of control. So I would love to talk to you because I can certainly find you a GI option. And I would like to hear a little bit more about your story to find out if you'd be eligible for a medically underwritten plan too. Like, I want to know about that because I help people with those every day, but I can certainly help you find healthcare and we can talk some more. But I'm telling you, there is no reason why you should not be approved for something. There is something for everyone, whether you are literally stage 4 cancer or the pinnacle of health. So you should 100% have healthcare. I am very sorry that you had that experience with whomever you worked with. But I'm glad you brought that up because I want to touch on that.
It's so funny that you said that was because I have a friend of mine who passed away like 8 years ago. And she found out that she had stage 4 cancer at the age of 30, and she had just declined her insurance because you're 30 and you're like, I haven't been sick for 10 years. Let me get rid of it for a little bit. And she went to the doctor for chest pain. It came back that she had stage 4 cancer. And even she was able to still get on insurance, even though she was like, there was no return. Like, we knew that she was not going to make it, and she didn't make it 6 months from then, but she still was able to get on insurance, which helped a lot because she still had, her family still had to take care of some of it later on. But I mean, it would have been a lot worse if she didn't get anything to cover, because that medicine was like outrageous.
And there's so many prescription resources out there, but yeah, absolutely. And I'll say this as a disclaimer for, a lot of insurance professionals out there. So you have different types of insurance professionals. You have the ones who work for themselves and they contract. Essentially, I'm contracted with this carrier and I'm contracted with that carrier, which means I have different contractual relationships, but I still work for myself. And then you have insurance advisors, agents, whatever you want to call them, that work with just a specific company that only sell one or two things, right? Or only provide. I don't even want to use the word sale or sell. It is one or two things that is offered through that company. So because it's such a big industry, you could literally talk to another advisor that is contractually in a relationship with that same carrier you had a bad experience with, but don't ever worry per se that you're always going to have the same experience, because there's hundreds of thousands of insurance advisors out there, hundreds of thousands of insurance agents out there. I am very disappointed to hear that you were not able to stay in contact with that producer, provider, agent, advisor. And I would love to give you some advice and some help on that. I do see that happen a lot, though. There's a difference between, and I'm sure this applies to every industry, people that are just in it for the career, and then some people who are in it because they actually like care. Some people are just there from the A plus B equals C standpoint, from like what this career provides for me. And then some people are in it because like, this is important to me. Like, healthcare is important to me. Being available to my clients important to me, and that's just not me marketing myself to you. Like, it's important to me. Like, I actually care. So and what if it was my mom? You know what I mean? Like, I've been in this industry for so long, and I've worked with so many agents. You hear horror stories of people that they call on the phone, and if you don't necessarily say what the other person wants to hear, you have agents who hang up on people, and like, that's terrible. You don't do that. Like, if that was my mom, I would hurt someone. Like, that's my mom. Don't hang up on my mom. She needs healthcare too. So definitely, book an appointment with me, text me, and I can put you on the calendar myself, but I will certainly find you an option or give you offers to consider, because I don't want you to go without healthcare. You definitely don't want to. And you never know what can come your way randomly from annual testing, randomly from going to the doctor. There's a gentleman that I work with, and he was having migraines and he couldn't figure out why. And he didn't have health care because he just didn't care to carry any. He's like, I'm super healthy. I used to, be a bodybuilder, like, like I'm the pinnacle of all, physical success. And he goes to the doctor for his migraines, and he was having like toothache. It was like all in this area. And he goes to the dentist. He's like, maybe I have cavities or something. It's causing my migraines. Like, all of this is connected up here. Comes to find out, when they went ahead and they were looking in his mouth, and then they were looking, like with their devices, in his nasal cavity, turns out he has a tumor and he has cancer. And this young man's under 30. So unexpected.
That's so crazy. I actually knew a girl in high school who had really bad headaches. And she went to a few doctors and they just kind of like dismissed her or whatever. And her dad was like, no, like he was so fed up. He went to a doctor and he demanded another scan, and they scanned her. And I remember she brought her scan into school and her entire head was covered in cancer.
Yep.
And we were in high school. And thankfully they were able to, like, she's still alive. Actually, she's about to have a baby and married and stuff like that. But it was like the dismissal one, because, oh, you're young, you're just having a headache, like it can't be that big of it. They would not give her a scan. And her dad was like, no, she's been having this for a very long time. Like, I need you to give me a scan. It's not just like a one, here or there. And so thankfully they had pretty good insurance to like get it done. And they were able to get it in time to where they could like treat it, obviously, because she doesn't have it anymore.
Yeah. I'll give you guys a perfect example, and I'm so glad she recovered from that. Again, you just never know. So I personally, I picked out a new OBGYN. It's kind of personal information. And we did my annual screening, and she was like, and I'm 36. So she was like, do you have a history of breast cancer in your family? And I was just like, well, I know my grandmother on my dad's side had breast cancer. And that was like when I was a kid. Like, I don't know anything about that. She's gone. My mom's gone. My grandpa's gone. Like, I can't ask anybody anything, so I just really don't know. I just remember hearing that. And she's like, well, you should probably get a mammogram. And I was just like, oh, one more thing I have to do. Like, this is ridiculous. But I was like, whatever, I'll go do it. And I go to get a mammogram, and they're like, well, you should probably come back for a second visit. And I was just like, great. This was like 3 weeks ago. And I had to get an extra ultrasound, and they found like a mass that was very small, very tiny. So they just want to monitor it in general. So there's nothing that needs to be done right now, but I'm generally in good health. Like, I don't have any medical conditions. I don't take any medication. And I found that out 3 weeks ago, so you just never know what you're going to find out. So you definitely want to go, out of your way to just at least have some health care, have something, even if sometimes you find yourself wanting to cash pay for different things. Healthcare is so flexible these days. Sometimes you get better rates if you cash pay on certain things. So that's a good way to kind of collaborate together also. So, but definitely have your healthcare if you need it, because you never know, man. It's crazy. So.
Yeah, this was really good.
Yeah, this is really good questions. I love this kind of Q&A stuff. This is great. Anybody else have anything?
Let me check the chat really quick. If not, thank you so much for coming on and talking to us about healthcare. And thank you again for getting me situated myself, and for being open to answering all the questions and stuff like that. I think it's just, again, it's something that's not talked about. It can be very tricky when you're not in that space and you just don't know what to do. Even when I was working in corporate, I still didn't understand the insurance. I just went with what most of my other coworkers went with, because I'm like, clearly they must know something I don't. And maybe I could have gotten a better plan. I never used it really anyways, but it's just good to actually understand what you're paying for rather than just paying for it. Now I know why I'm paying for certain things and what coverage would be best, and stuff like that. And it's good to know, because why throw your money away? Just because at least you can understand where your money is going. And if you're truly going to be covered, because like my friend who had cancer, the coverage that she dropped would not have been the best coverage if she would have found out she had cancer anyway. So it's kind of good that she dropped off and got something different, because she had like the basic of the basic, and it would have hurt her even more in a sense. So this was really, really informative, and like, stay with me forever.
I got you
Never
forever. I'm
leave
not
me.
going anywhere. And keep in mind, just to piggyback on what you said, and I'm so grateful that I had the opportunity to help you. Like, again, I love helping, and healthcare is something that changes all the time, and your life changes. So right now you might need a plan that just meets these needs. And then maybe in a year, you're like, you know what? I'm okay with paying a little bit more. I think I need more coverage. It's kind of like car insurance. Like right now, I only need this on this vehicle, and then I want to get a nicer vehicle or whatever. I'll get different kind of coverage for that. So healthcare is something that's ever changing. Offers are ever changing. So as a client, Saba, if you ever want to be like, hey, can we just review some offers? Is there anything else out there? Is there any better deals that I should take advantage of, or any better plan options that are kind of coming on the market with new companies and stuff like that? And we can do that too. So.
Yeah, so this was great. Thank you so
Awesome.
much. As you all know, I think Patricia came in a little late, but Patricia, Brandy posted her number, her Calendly link and stuff like that, if you wanted to like chat insurance. And it doesn't even have to be about getting insurance for yourself as a business owner, but it could just be about comparing what you have right now, and just to see if are you truly in the right plan, and just really understanding what you're paying for. So you can always reach out to her. She's on TikTok, she's on Instagram. I just tagged her as well. If you want to go click in my story, you can find her. And then again, she's super open book. You can always email her and she'll get you all the way together.
Absolutely.
All
Thank you
right,
so much.
so thank you again. I will be posting the replay, and I'll be adding your information to the end of this recording, so that they can still have it as a resource to anyone watching the replay. So then you'll see them kind of trickling into your inbox from there.
Absolutely. I'm happy to help you guys. Saba, thank you for the platform and the opportunity for me to talk to you guys about healthcare and just like those things you might not necessarily know. And I'm here for you guys whenever you need me. I'm always working. So just text me, call me. My TikTok is very premature, so I'm working on it. I'm gonna get better at it.
It's okay. It's okay.
But
we know what that feels like. So you don't even have to worry about it. We won't judge you, because you're knowledgeable. That's all that matters. It doesn't matter.
All right, guys. So you have a blessed day. I look forward to hearing from you, and I'm always a resource. So thank you so much for your time.
Thank
All
you
right, you're
so
welcome.
much. This
Thank
was great.
you.
All right. Bye, guys.
Ciao.